A warm welcome to all the participants from our nation and abroad, and Fitness and Rehab India YouTube channel subscribers for the EXRX India presenting Sri Samraj Health Services Private Limited's Webinar Super League, an attempt to a world record event, Series 3, Session 15, Lecture 48, in association with Sri Samraj Physiotherapy Center, Dindivanam, Pickle Studio, Chennai, Physio Active, a wellness hub, Gurugram, Sairam Academy, Chennai, powered by Fitness and Rehab India YouTube channel. Today's topic is principles of exercise and importance of targeting fast twitch muscle fibers. Will be presented by Dr. Durga Pratap MPT, Neuro, Instructor, Strength and Conditioning, Physio Needs Academy. I welcome Dr. Priya Sri Samraj Physiotherapy Center and EXRX team members, Dr. Rupesh and Professor Duna Saha. I welcome Dr. Durga Pratap to start the session.
Thank you. Thanks for warm welcoming, Doctor. And myself, I'm Durga Pratap, and I'm formerly assistant professor. And now I'm doing well with my clinic, and I'm conducting the strength and conditioning course for physiotherapists. And so it's my golden opportunity to reach you with the very basic yet very good topic, principles of exercise and importance of targeting the fast twitch muscle fiber. So this is the ideal goal of this session is to reach the participant with the basics, the exercise physiology and the importance of the fast twitch muscle fiber training. Okay, so let me go directly to the next page. So kindly share next page. Yes. Okay. This is one of the wonderful picture. The year, 6 months back, I come across, and it is one of the best picture which can give us a lot of opportunity in future. So this is the small representation of the aging and the world population. So you may wonder, like in 1950, in the picture, if you see the below under 5 years, there was a lot of children were there, and the age 65 plus populations were very less in all over the world because of the war and a lot of chronic diseases and infections. So many people, they die prematurely around 50 to 60 years. And we were having the very less population more than the 65 years old. Now what happened, this trend is shifting to opposite side. You can see clearly by the 2010 to 2020, tragic improvement in the aged populations. That doesn't mean we do not have producing the young populations, but the problem also you can say it's a fortunate that we do have the more number of 65 plus population in the world. This is one of the biggest concern. Like if you look at this map, it shows that why this has happened and why it is keep increasing the older population all over the world. Thanks to the science, we do have the very good vaccination. We do have the anti-hypertension and anti-diabetic medications. Medical world is evolving in a really good manner. So we could able to save the millions of lives. So savings of millions of lives, definitely the allopathic medical world is doing. So what happened is you are just putting the patients with the chronic medications just to save their life, and increasing their life duration doesn't mean it increases the quality of life. This is why it is a huge burden on the healthcare system having the 65 plus population. Just think, if in your home, if you do have one or two people with 65 plus years old with the chronic disorders, having some balance issue or risk of cardiac and stroke. So what happened here, you have to give a lot of concern for them financially, and personally need to take care of them, and it put a lot of pressure in social and personal and economical way. No, another one of the biggest thing is if they fall, they get injury and they become the disabled. So this put a poor of life quality in them. So having the 65 plus population is cannot be the healthiest sign, because without quality of life. That's why I would like to say physios are much having the opportunity in these areas to reduces the burden on the healthcare system by practicing the exercise to reduce the disease burden. We know that these medications just to improve their lifetime, not improve their quality of life. So being a physiotherapist, you should take the things very seriously, practicing the exercise for preventing, treating the chronic disorder like hypertension, diabetic would really help these people, individual to make their life very quality. So I would like to go next slide. So today my more focus on the sarcopenia. Okay, you all may know very well about the sarcopenia. I'm starting with the explaining the small fact about this MRI pictures. So this is the picture of MRI and the cross sectional sectional view of your femur, and you could see the well developed quadriceps and hamstring muscle in this picture with the bone in the middle of the picture. And if you see the left and the right side picture, the left side is the 60 years old elite and the exercise, the person who usually do strength and endurance exercise regularly. And on the right side, if you see the same age group, but he is sedentary man who doesn't do any exercise. So what is the difference you can see between them? The left side picture, you can see the muscle mass is more with less fat accumulation. If you see in the darkest portion of the picture, that is the muscle mass. The white patches seems to be the fat deposition. And the more the darker portion, which shows the healthy lean muscle mass, on the right side picture, you can see the very lean, very less amount of the muscle with a lot of fat accumulation. So this is called as compartment sharing. It's a fundamental in the exercise physiology that if you do have the more amount of the lean muscle, automatically it reduces the fat accumulation. So to have the lean muscle mass, definitely exercise is what much needed, not just nutrition. So this is the one. If you go more deep, I can easily tell that this 60 years old man who does a lot of exercise definitely do have the very good quality of life. He can run, he can do his own work, he can help others, and he can still work. But in the right side, he is after the medications, after the laboratory tests, and after the some dependency from their kids. This is how I can give you the orientation. So why exercise is very important to prevent the sarcopenia and other disorders. So let's go next slide. So I always ask what is muscles? If you just say being a student or physio, if someone asking you what is muscles, so you may end up in saying muscles are connective tissue which moves the joint and it stabilizes the body, of course, against to the gravity. So, but there are a lot of other things out there than the just giving you the proper physiological or anatomical explanation. So what we shall see that yes, it is the connective tissue. It connects the joints and it supports the musculoskeletal system, and it is the movers basically. Okay, you can move, you can walk, you can lift, all because of the muscles. Also, it's a stabilizer. Against to the gravity. This is what making you to be stable on the air. But apart from that, these are the basics which we all know. Apart from that, it stores the energy. Yes. So all the ATP, apart from the liver, the majority of the ATP is stored inside the muscle without insulin, help of insulin. That's why we call them Doing exercise is the one of the best thing you can do with the insulin sparing. So also it enhances the hormonal secretion. It stores the hormones. It transports the hormones that especially the insulin like growth factors, endothelial growth factors, and you do have nitric oxide and your growth hormone. These all the hormones, testosterone, of course. This all the hormones are much has a good link with the muscles. And the very important fact that immunity, yes, exercise and muscle mass definitely supports the immunity. So if you see someone with the viral disorders, they do have the very good muscle amount of the muscle in their body, they definitely recover quicker than the people who do not have the much amount of the lean muscle mass. There is a reason why, because when you do exercise, you probably creating the muscle breakage, which increases the inflammatory response. This inflammatory response again and over, which helps the immunity in an adequate level. That's what the science says. The another area is your waste removal. So when you do exercise, definitely you're breaking the muscle cells that's supposed to remove from the system to build the new muscle fiber. The waste removal is the fundamental procedure that comes from the immune response. So if you do, especially the phagocytosis. So if you do have the very good immune system with the very good muscle mass, definitely this procedure will be adequate level that supports the immunity. So not only, see, when you doing the regular exercises, regularly injuring micro trauma by doing the exercise, the waste removal is again and again it happens. It not only remove the waste from the muscles, also it supports removal of the microbes from your body. And another one is the BCAAs, branched chain amino acids, and glutamine. You know, branched chain amino acids, valine, leucine, isoleucine, this is what made up of muscles. Okay, majority of the muscles made up of these amino acids. It's a complex structure of protein molecules along with the glutamine. So the glutamine basically is again the non-essential amino acids which present inside the muscle, which helps to form the immune cells. And another side, BCAA helps us to fuel for your muscle to reduces the burden on the immunity. Okay, so definitely for the immunity, the muscle mass and the regular exercise helps a lot. Next one is the osteoprotective. So I would like to ask, like, if you do have this someone with the osteoporosis, what would you do? You do weight bearing exercise. Okay, so if you do have the very good muscle mass, it put a lot of mechanical pressure on the hardware, the osteo, the stem of the bone, which act as the mechanical stimulate to produce the more bone cells. The people with the good amount of the muscle mass, they naturally to have very good density in their bone as well. Okay, so the osteoporosis, if you do have someone with the osteoporosis, just think about the muscle mass. If you improve the muscle mass, indirectly it improves the your muscle bone density as well. So anti-aging, okay, what will happen when we get age? Sarcopenia, loss of muscle mass during the aging is the normal process. But what if you do regular exercise? Definitely it reduces the aging, it slows down the muscle mass loss. So you know, this is why I call this anti-aging. People with the very good muscle mass, they do have less amount of the fat. That means they are having the very good cardiac functions, and lesser amount of the fat mass also improves their perfusion. You know, muscles are receiving the better perfusion than the fat. So more the perfusion, the peripheral vascular resistance would not be big burden. So they do get the very good blood flow everywhere. So again, if you do have very good blood flow, what will happen? This is one of the anti-aging. People who do exercise, they improve the blood circulation even to the brain, which prevents them from the Alzheimer or other neurodegenerative disorders. And of course, you will be having the very good skin. And exercise is the form of stress which improves the the removal of the free radicals, oxygen free radicals, which definitely proven to be anti-aging, and better bone mass and better strength, better balance. This is what everyone dreaming for. So another new study which I come across recently, it found that they did this study on the mouse, and they are claiming that the mouse with the very good muscle mass shows very good recovery from the viral diseases. So this makes sense that we are in the pandemic, and doing the regular strength exercise along with the cardio definitely put a good, very good muscle mass, which can be a good thing that if someone suffering from the viral illness, they can have a greater chance to recover quicker. Next slide, please. Next slide. So here is very important. What would happen when we get age? So this is the presentation looks like in the men when they get age. You know, why Dhoni or sports athlete, they are very good at 18 to 35 years of their age, not after 35. Because of this, you know, muscle is what your performance, muscle is what everything. So when you are young, so 18, probably your testosterone and other hormonal profile uh, quick up in the men. Another very, very important thing I would like to quote here is, after 18 only you will be having the well developed endocrine and well developed energy system in your body. That's why the muscle growth and lean muscle mass will be higher in 18 to 35. If someone want to start their journey in the fitness to aiming the getting the better health, it's supposed to be in 18 to 50, 18 to 35. It's a really brighter chances them to be have a very good lifestyle. And you can see here 18 to 35, they do have the 40 to 45 percentage of muscle mass. That's a really huge amount as per our genetic. But this is for people who are active. It doesn't mean that if someone eating the junk food and slouching in their couch, definitely this cannot be possible. But if you are active male, definitely in 18 to 35 you will be having the 40 to 45 percentage of muscle mass. That's why in this age, most of the Olympic champions are made. They are in their best in 18 to 35. So what happened after 36? You started developing the slow, steady climbing of sarcopenia, and so many factors related here. You know, your eating habit and your sleeping pattern and your activity levels. This all decide, and you can see here slowly it goes to 36 to 40 percentage. So what would happen when you lose the muscles? Definitely that area will be accumulated by the fat, and you will be losing your bone mass as well. So 50 to 75, greater decline in the muscle mass. 30 to 35 percentage it comes down, and again 76 to 85 you will be having the very, very lesser 30 percentage of muscles. This is really a bad sign. So doing the regular exercise slow down this progression. That's what I call them anti-aging. So we shall see in the next slide about the women. So what would happen in the women? You know, women naturally they do have the more amount of the fat in their body because of the breast and their hormonal supports, fat accumulation. And you can see here are again 31 to 33 percentage in 18 to 35 years, which is equal to the men in their 60s or 50s. Okay, so again 36 to 55 is a very crucial time for them. They are near to their menopausal, and after a few pregnancy they tend to have the more amount of the fat storage. That's why, you know, 36 to 55 is the age women should take care of their strength and muscle mass. If they fail to do so, definitely they will be ending up having the lot of problem with their knee pain or degenerative cartilage diseases, because of the muscle mass loss. So 56 to 75 against 27 to 30, it keeps declining. You can see clearly, and 76 to 85, when they get age older, they'll be having the 26, or lesser than the 26. This shows that women naturally tend to have the more amount of the fat than the muscles, and this can be the reason. That's why they are getting the problem with the knee arthritis than the men. But there is no study in this area. But it's like, you do not have the studies for many basic things, but doesn't mean that the fact is not true. So I really would concern about this, because and I would say strongly, the women supposed to start their exercise as early as possible to prevent their from the fat accumulation and knee arthritis. So next slide. So why muscle matters. This is why. Fat actually really bigger. They are hard and really bigger, and they float. If you put the fat on the it's just oil, put it on the water, they float. And if you compare with the lean muscles, I'm 69 kg now. But if you want to see someone with the 69 kg in my height without lean muscles, they look really bigger than me. Okay, so what does means, like, you need to have the weight loss, just fat loss. You should keep growing the muscle, but only the fat supposed to be reduced. This is misunderstood by many fitness industries and fitness people. They do a lot of cardio workout, that this, to reduce the weight, but it is not the fat. Most of the time it's from the water loss from their body, and it shows that fat loss. Okay, so the actual fat loss needs to be trained with the science. Okay, being a physio, you might get a lot of idea in this. So here in this picture, I want to say, the muscle looks really thinner than the fat. So this naturally gives the better physique than the body with the more fat. Next slide. Next slide. Okay. Again, why muscle matters? There are few studies available which says your muscles are very, very protective for your body and health. No, in the Alzheimer disease, it reduces the severity of Alzheimer disease, people in long-term care. Yes, people with any chronic injuries, chronic diseases, they tend to lose their muscle mass quicker. If you compare the Alzheimer patient with the normal aging patient, there will be lot of difference. Muscle mass is the one of the major problem that directly put pressure on their musculoskeletal system. They fall. So the study says that muscle mass is higher in these people. Definitely, it slowed down the progression of the Alzheimer disease. Then next, the reduced ventilation time and length of stay in the intensive care unit, and higher rate of survival inside the ICU. I already told you, any patient going to the ICU, they are in the bedridden. Just to imagine, they are in the bedridden. Each day they are losing the percentage of the muscles. So if you are having the very good amount of the muscle already, it stores the more amount of the blood, it stores the more amount of the amino acids, which fuel your body to produce the immune cells. In the recommended position, in the supine position, if you are resting for a longer time, it reduces the much amount of the muscle. If you have already good amount of muscle, definitely it can give you the chances of survival higher. Okay, I already discussed with you how immunity impact with the muscle mass also. This is one of the very good study that shows muscle mass is very, very important. If you are treating the patient in the ICU, definitely take care of the muscle mass. By electrical stimulation or active assisted exercise, muscle mass is very, very essential. And also reduced risk of complication for the patient after surgery. This you can easily correlate with the trained population undergoing the surgery or untrained population going for surgery. If you are having this someone with the ACL injury, some sedentary men got ACL injury, he might show quite a longer duration of rehabilitation than the someone with the athletic history. Because athletic people already having the very good muscle mass, they tend to quick up their recovery by doing the better exercise and better pain tolerance and so on. So also the better response to the treatment to for cancer. This is one of the very, very important things. I personally having the some cancer patients, and if someone having the cancer, they should go for the radiotherapy and chemotherapy. These both therapies are catabolic. Catabolic in the sense they reduce their muscle mass very, very quicker. So if you are having the very good muscle mass already in your body, definitely you will be having the better tolerance to these kind of therapies. And again, in the respiratory disease, in a COPD, what happened here, you spend a lot of energy just to take a breath and breathing out. Your energy will be running out because of the breath, which you are putting a lot of strain in your lungs. So what happens if you do have a very good amount of the muscles? Definitely, it stores the more amount of the energy, and muscles are the fuels. If your body is not having the much energy, muscle break down themselves to form the amino acids. We do have the glycogen, we do have the fat, we do have the muscles. Okay, these muscles break down themselves to form the energy. That's what we call them catabolism. Catabolism is good when you are running out of the fuel or in a certain circumcision. Okay, if you are not having the very good amount of the muscle, this catabolism cannot build the energy. That's why they suffer a lot from the uh, respiratory parameters. And also, I already discussed with you, it is protective for the osteoporosis and osteopenia, and higher survival rate from the trauma. Of course, you know that many parameters are there for that. So we shall go the next slide. So we are starting with the basics, how muscle supposed to be in your body. Okay, so you can see here three different muscle fibers are there. This is how we are made up of. Okay, if you are untrained population, you are not doing any exercise, you are just doing the normal daily routine, your body used to usually have a mixture of these three fibers, but this is limited to the certain area. For an example, post postural muscles, neck muscles, my back muscles, they do have more amount of the type 1 fiber, red fiber. Why? Because this is the design. Okay, I am standing here, I'm sitting here quite longer time. My neck extensors are quite working without getting fatigue. Why? Because these are the postural muscle. They should not get fatigue. That's why they do have the more amount of the red fiber. So if I do a lot of exercise with the resistance in the neck extension, definitely I change my red fiber to the intermittent fiber or the white fiber. Okay, so this is the simple idea. We do have three muscle fiber. I will take the example of runners. Okay, we can have example of many sport, but I'm taking the runner. So you can see the long distance runner. Okay, this is the biopsy of VMO. Okay, vastus medialis muscle. So if you took the biopsy and see under the microscopy, the long distance runner like marathon, cross country runner who runs slow and steady without getting fatigue for a longer duration, they do have the more amount of the red fiber. Why looks more red? Because this has better oxygen carrying capacity. Red means it has the oxyhemoglobin. These molecules are having the more oxygen binding capacity, so they can utilize the oxygen to form the energy. This oxygen to form the energy is not readily available energy. I will discuss that energy system quite later. Okay, that's why they look red, but they are very, very good at fatigue resistant. They can run slow and steady without getting fatigue, but they cannot lift the bigger weights. They cannot run faster. because to run faster and lifting the huge weight, you need the strong fiber, but these red fibers are lean and very slow twitch fiber. They cannot fire in a faster amount. Okay, so we do have the intermittent fiber. Intermittent fiber, someone like Djokovic, tennis player, or someone like Ronaldo, like you can say these players also run quite longer time. They are in their game for 90 minutes. They run here and there, but when the ball comes, when they can also burst the energy, they can run quicker to get the ball. So they do have the mixture of both fiber. They need to have the fatigue resistant as well as they need to have the fast firing. So that's why they are in a brown in color, for an example. They do have the mixture of red and white fibers. So we call them type 2A fiber. Okay, this one left side one is the type 1 fiber. The intermittent fiber called as type 2A fiber. The next, the best must one is the type 2B fiber. This is the sprinters fiber or powerlifter fiber or gym people, bodybuilders fiber. Today's session is more about this fiber because this fiber is most ignored for fiber in the rehabilitation, and it is one of the biggest concern fiber. Why? Because this white fiber, they can't save more energy. They don't have the axic hemoglobin. They depend on the storage of energy in the ATP, which store inside, because they do have the large and thick fibers. Their firing rate is very faster, very quicker. So for an example, your grandma want to get up from the chair. She's troubling again and again because she is lack of white fiber in her gluteal muscles. Okay, gluteal muscles tend to have more amount of the white fiber because they are looking bulk, right? Your gluteal muscles are quite bulkier than other muscles. They do have the more naturally. They do have more amount of the white fiber. So as you are getting age, sarcopenia directly impact these white fiber. White fiber loss is the higher in the these individual. That's why they cannot get up. This shows white fiber is not there. They tend to fall. They tend to feel the weakness. So white fiber is for your strength, fast firing, pushing the higher load, and running faster. Okay, so next slide. So again, this is the biopsy, actual biopsy. This is not just picture, actual biopsy. You can see the red fiber. They do have the color, red color more dark. And B fiber, is a mixture of fibers. And C fiber, which is sprinter fiber. You can see the fiber, thickness of the fiber really bigger. The C fiber is, but they tend to get fatigue quicker because they can't store the oxygen carrying capacity. They cannot utilize the oxygen to form the energy. That's why we call them anaerobic fibers. Next. So now we'll see the functional properties of these fibers. So if you take the contraction time, how quick they can contract. The slow twitch muscle fiber contracts slow and steady. That's why they can run slow and steady for quite longer time. And fast twitch, it can be faster, but the fast twitch type B is more faster. I mean, the white fiber is more faster than all these. So size of the motor neuron. So motor neuron, you know that you do have the alpha motor neuron and you do have the frontal cortex neurons. These neurons are quite strongly connected with the white fibers, but it is strong. It is not that stronger. It's a very small motor unit for the slow twitch fibers. And resistant to fatigue, which is fatigable fiber. White fibers are fatigable because they can't store the energy. They are dependent on the stored glycogen. They cannot just simply form the energy using the oxygen. And activity used for aerobic, long-term anaerobic. Long-term anaerobic means, I told you already, the football players, they run here and there. They short intermittent running again and again they can able to do. But fast twitch muscle fiber, they are like running in first 10 seconds, quite faster, or maximum 1 minute. Okay. So again, force production, which is the stronger muscle? Definitely white fiber. That's why I wanted to say that if you do have some weak populations in your clinic because of their muscle weakness, they can't get up, not the neurogenic muscle weakness, I'm talking about the age related disused muscle atrophy. They should focus on training for the white fibers. Do not set the program, design the rehabilitation program to target the slow twitch fibers. That's why I don't advise them to go for cycling. Do cycling slowly, 20 minutes. No, you need to increases the white muscle fiber. You may able to do like cycling weekly once, not daily. So daily making them cycle or walking doesn't improve their rehabilitation outcome. You need to target the white fiber to make them stronger. And mitochondrial density, this is the blood, the energy of the energy delivered by the mitochondria will be higher in the slow twitch because they do have the oxygen carrying capacity, and remaining other fibers are not that higher. And oxidative capacity, how well they can use the oxygen. Definitely the slow twitch marathon runner can use the better oxygen capacity. And glycolytic capacity, of course, glycolytic means you utilizing the ATP breakdown of the carbohydrate will be higher with the fast twitch muscle fiber. They can use the energy very quick in a short quantum amount. Okay, so major storage of fuel, you can see triglyceride is very essential for the marathon runner. They need to take plenty of carbohydrate with the fat, but fast twitch muscle fiber takes energy from the creatine, phosphate, and glycogen from the stored from the muscles. Okay, this is the some differences between the each muscle fibers, which is very essential for your clinical practice. Next slide. So let's go with the energy system, very basic fundamental energy system. As I already told you, so you have the marathon runner. They do not use we do have the three different type of energy system. Okay, one is the PCR system, phosphocreatine system, which is just stored glycogen. So for an example, if you're starting running at your maximum speed, just a few seconds it lost. Okay, after that you cannot utilize, which means it stored glycogen inside the muscle to fire, but muscle cannot store the maximum amount of the glycogen that can be used for more than the 6 seconds. So another one is you have the glycolysis system, and which won't use oxygen, but it increases the carbohydrate fuel inside the muscle through the transportation, and this form the energy. For an example, this will give you the energy for the up to the 200-meter or maximum to the 1500 meters. So if someone is doing the marathon, they actually utilize the complex of energy system. One is the citric oxide, another one is the electron transport system, and another one is the oxidative system. These are three needs the oxygen. Okay, I could call this as the slow energy system, which means it takes plenty of time to form the energy. So when you take plenty of time, definitely you cannot contract the muscle quicker. So so your training is what making them to develop these different system in their body. Okay, so these are the very basics about the energy system which we do have. And just to keep it simple, the aerobic and anaerobic energy system. Aerobic energy system utilize the oxygen, especially in the marathon runners, and anaerobic energy system do not use the oxygen, and they are more in the marathon and the game which is lesser than the 1500, or if you go lesser than the 100-meter, it utilizes more of the stored glycogens from your muscles. Next slide. So we are here for the now principles of exercises. So anyone who practice the exercise without knowing the principles, they cannot practice in a good manner. So this is the picture of Milo. He is the he was in the ancient time in the Greece, and this guy was lifting the small calf on his shoulder and walking few distance daily. Okay, so what happened, he was very small at a small age, like he was like a teenager, and daily he was lifting the calf and walking few distance. You know, this calf was growing faster, and daily few more pounds are added on his shoulder. So as he is lifting daily, he adapted with that stress, and he were able to build the very good muscle mass in his body. So when the calf become the bull, he also become really a big, like a warrior or like a wrestler. So what this picture tells us is progressive loading you need. Okay, so in the exercise we call them intensity in the aerobic exercise can be the VO2 max. Anaerobic exercise like resisted exercise, we usually uses 1 rm or 10 rm. Keep it simple, 1 rm is better protocol than the 10 rm. So we uses the 1 rm principle to increases the muscle mass. What you need to know is you need to add every 1 to 2 weeks, you need to progress the load. Simply how it means, for example, each muscle in a weekly twice you can hit. Okay, for example, today I'm doing the exercise for my chest. The same week, again once more I can do the chest after 4 days, and in after 2 weeks again I need to progress the load rather than the keeping the same weight. This is the biggest challenge in the rehabilitation. You know, in the most of the rehabilitation we do under training. Okay, we treat the ACL injuries, or we treat the someone with some small injuries, but he is the person capable enough to lift little bigger weights, but due to our unawareness we are having little hesitation to progress the loading. Okay, so make sure you are progressing the resistance in a percentage wise, like a 30 percentage of 1 rm, then 40 percentage of 1 rm in a weekly or 2 weeks once if the pain and other parameter permits. So that is the healthiest sign which you can peak the muscle mass and performance. And in case of the aerobic exercise, we call them VO2 max. You'll be starting with the 50 percentage of VO2 max, then you'll be going with the 60, 65, like that you need to progress. Next. So this is the training cycle looks like. Okay, so you are starting the person who is zero level. Okay, is untrained person. So when you do the exercise, the next day, doing the exercise, what actually you are doing is you're breaking the muscle cells. Okay, because of the load, extra load, and you're causing the fatigue and fatigue related failure with the eccentric exercises. It causes micro trauma. It breaks the old muscle cells simply. And this is called as training stimulus. This produces the fatigue for a few days. Okay, because when you train for 15 reps, muscle get fatigue. Again, second set, third set, you're completely destroying my muscle now. And later on, what happened? This fatigue causes inflammatory phase and delayed onset of muscle soreness. Then the recovery starts. The new muscle cells are growing up, and I will explain how the physiology of those things happens. So now the first cycle of super compensation comes. Okay, so this is the cycle. Okay, you'll be having some genetic limitation. You cannot keep growing the muscle. Human can gain the muscle for the certain amount. They cannot overgrow it. Why? Because we do have the genetic material, genetic memory, which allow certain amount of the muscle mass. But as you see in the bodybuilding industry, they do have the very bigger muscles, which is genetically overloaded because of the steroid and other things which they are trying. That is the unnatural one. Naturally, you can keep this cycle over and over to attain the peak level of muscle mass and performance. So for this, you need nutrition. Yes, protein and carbohydrate rich food. I mean, the complex carbohydrate also fuels your muscle along with your protein to recover. And the sleep is very essential. If you are training any patient or individual, you should ask them to sleep 7+ hours and rest interval. You cannot train the same muscle again and again. Okay, I would suggest if you train today, at least give 3 to 4 days rest. Muscles are after the DOMS only you can train. During the delayed onset of muscle soreness, never trying to train the same muscle because it affects the recovery of the muscle. You cannot get the adequate the hypertrophy which you are dreaming for. So another one is the supplementation. Supplementation, yes, of course, it is necessary in a sports population or in a people with the chronic disorders who cannot meet their nutrition with the uh, regular food. Being a physiotherapist, it can be out of your scope, but having the good knowledge on these areas definitely help to you, to help to your clients or your patients. Next, the principles of specificity. This is one of the best principle ever, and the most problematic principle for physiotherapist, I could say. And why? Because you get the here there are two chances you can mess up with this principle. Okay, I will share my point of view, my experience on this. I got a patient who is a marathon runner. Okay, he was having the OSD. OSD means OSD. Oswald is some. I forgot the name. Yes. Thanks for reminding me. It's just like the spur formation in the tendon on the patellar tendon. So what happened? This guy, the problem in India, openly I'm telling, I worked with the many athletes. They are not actually forming the very good periodization of training. Okay, they do not follow this principle of specificity. Their most of the training are for 100-meter also same, 500-meter also same, 1500-meter also same, cross country runners also doing the same. This is the biggest mistake. Each game should develop its own strength and conditioning program in order to gain something. Okay, definitely all will do all in a certain amount. Okay, if you see the Usain Bolt, we will be having the more focus on the type 2 fibers, type 2A and B fiber, especially type B fibers, because he is the power runner. Okay, it means he is running very short duration. He need to use the fast twitch muscle fiber. But the another guy, he is the marathon runner. He should use the slow twitch muscle fiber. So his training should be prolonged and slow and sustained. Okay, both are injury prone. Both are injury prone. For an example, the Usain Bolt, if you take, he suffer more from the acute injuries like muscle tears because he's running quite faster. But this guy, the elite marathon runner, he also suffer from the slow sustained injuries like tendinitis, those kind of issues. So what happened here? When I had that runner, he's a cross country runner. He used to run 10,000 meter. So he was suffering from pain. I could see his VMO is wasted. He was not having the terminal extension with muscle power 4. It was just muscle power 3. If I put resistance, VMO is not recruiting. He's having more pain. So I understood that, okay, here my specificity is telling me to do the slow sustained movements like marathon runner, but I cannot stick with that protocol for him. For him, definitely need the fast twitch muscle fiber now to enhance the muscle power. Okay, fast twitch muscle fiber, when you train, it also improve the collagen deposition on the tendon. It improves the viscoelastic property on the tendon. Okay, because the stress is what makes your musculoskeletal system capable enough to withstand the stress. The biggest issue here, either we will be completely going with the specificity to develop the athletic performance. In that, we will be compromising the in marathon running, we are compromising the strength. Muscle fiber type 2 is also important for them. At least 5 to 10% they need to train for the strength and power. That is my point. This marathon runner was not trained with the resistance much. He was doing just running, swimming, those kind of marathon, endurance type of activity. That's why his ligaments, everything is weaker. So what happened? Weaker ligaments, they cannot withstand the slow ongoing stress. This is why they get the this inflammatory degenerative disorders. So definitely I would suggest to use this specificity principle, yes, for the training as well as the rehabilitation. So if someone coming to you with the ankle injury, you'll be focusing more on the resisted training and conditioning. Okay, so but make sure you are having the very good idea on the specificity, what sport they are having in the sport, what kind of demand they need to carry out. So according to that, you need to fix the specificity program for them. The next slide. So next is the FITT. Okay, FITT. This helps me to implement the protocols. If I want to make this some protocols, I definitely need to follow this. So all the principles you can apply in the inside this principle. Frequency, I usually make either frequency of week or frequency of month, depends upon my individual clients. Okay, so for an example, if you do have the someone for the weight loss, definitely you need to go with the monthly protocol rather than the weekly. So these we call them microcycle or mesocycle. So but if you want to be more specific to the particular target, then go with the microcycle, I mean the weekly progression. So weekly, how many days you should work out, that is very, very important. Okay. So intensity, I already told you, if it is the aerobic activities, intensity can be the VO2 max. How faster and how much they should run. Okay. If it is, for an example, if it is a resisted exercise, you'll be having the 1 RM. Select the 1 RM. We do have the calculations. If you Google it, calculation will be there. You can easily identify their particular person 1 RM. And the time is about how long they are working out on the particular set or particular workout protocols for a particular day. Okay, that's the timing. And the type is a vague terminology. You are you using the free weights of exercise, body weight of exercise, aerobic exercise, swimming, whatever. Okay, keep this FIT principle very sensitive. Why? Because if you use the same this frequency, everything, you cannot get the results. So in some cases, what you need to do, frequency you can alter. In some cases, you can alter the time. In some cases, you can alter the type. This should be very, very dynamic. This principle should not be stable one. In order to get the performance ongoing results, you should have the FIT principle to be modified over and over according to your desire and specificity. Okay. So next. Next. Another one is the principle of reversibility. You can see the left picture is really bulk and right picture will become very lean. This is what happens when someone stay away from their routine exercises. In a quarantine now, gyms are not open, people are not doing exercise. Definitely this would happen. You know, this because of, this is the basic physiological theory. If you use it, you will keep it. If you don't use it, you will lose it. Okay. So in order to have the maintenance, at least 2 days in a week, you need to train. That's what this science says. Next. Next. Yes. So frequency, if you want to have the very good results and hypertrophy, at least 4 days in a week, you need to work out in a very good intensity. Okay. If you want to maintenance your performance, either it is cardiac or either it is muscular, you should do at least 2 days in a week. You should do the optimal level of exercise as the stress or as the growth stimulus. And very important, if some people they go for every week once they do leisure activity, that doesn't improve anything. This is the point. Okay, at least 4 days in a week for the ongoing progression, at least 2 days in a week to maintain the performance. Next. So this is something, again, the training parameters which you need to taking care. If you want to improve the muscle mass, I mean the complete lean muscle mass, you need to train for the maximal strength, which is like 1 to 3 reps. You know, we call them 85 to 10, 100% of your 1 RM, which utilize the ATP and PCR system. And this you cannot do more than the 10 second. Okay, so just your. Yes, I will be sharing, sir. Uh, this is very fundamental, that power athletes like a big strength man athletic competition, they utilize the maximum strength program, clean and jerk, squatting with the higher load. They cannot do more than the 3 reps. That is something 80. This gives you also idea 85 to 100% of one arm. And if you want to have the strength, maximal strength, otherwise we can call them power. Okay, if you want to improve the strength, 4 to 6 reps of 3 sets you shall go with. Okay, usually we do have the 3 sets or 4 sets formula in our exercise program. In that, reps should be the 4 to 6, and this can be done within 10 to 20 seconds, and the range would be, the intensity would be 75 to 85% of your one arm is much essential. So if you want to have the hypertrophy is like muscle growth. The third protocol is for the beginner. Okay, be sure, third protocol for the beginner, and the second and first protocol for the advanced lifters, advanced sports related performance. And to have the basic hypertrophy program, you need to do 8 to 12. This can be the best for the rehabilitation of many musculoskeletal injuries. Okay, so you'll be doing the exercise within the 45 seconds. I mean within the 1 minute, and it utilizes the anaerobic glycolysis system. At 60 to 75% of your one arm should be utilized here. So for example, if you could able to squat for once 100 kg, then you shall do the 8 reps with the 60 kg or 70 kg. So if you want to develop the muscular endurance, for an example, if you feel some athlete needs to be trained for the muscular endurance, like marathon runners or someone for the long distance swimming, they can use the resisted exercise in the tempo of 15 plus range resistance, using the lesser than the 60% of their one arm. Okay, this utilize the oxidative stress and your aerobic energy system, where you utilize the more amount of the oxygen to do the activity. For example, simple body weight squats for the 30 reps or 20 reps utilize the muscular endurance properties. Next. So, how hypertrophy happens. This is the beautiful physiology the one should understand. Okay, so to get the hypertrophy, we need to focus on the basics training methods. Okay, very important is eccentric mode of exercises. If you are lifting the weight, lower the weight slow as possible. Always concentric movement should be quick than the eccentric. Eccentric, the more the slower. What happened here, you are loading them and slowly you are releasing. What happened here, micro tear happens. The training is about tearing your muscles in a very nano way. Okay, the more you tear the muscle in the eccentric control also put the lot of stress on the neuromuscular connections. Okay, because you are pushing the weight in a slow way, you're lowering the weight in the slow way, that put a lot of pressure in your muscle. The muscle cells get breakdown. So what happened after the eccentric training, microtrauma happens. This you cannot see visibly on the muscle, but you can see in the under the microscope there will be structural damage and inflammation comes. We call them delayed onset of muscle soreness. Believe me, delayed onset of muscle soreness are very vital. Why? Because this is the recovery which your muscle actually getting. Okay, inflammation, you will be having the more blood, you feel more tender, more swollen, and you tend to apply the ice to comfort, and spasm, protecting muscle spasm also will be there. This, then a lot of blood goes, phagocytosis happens, a lot of immune cells go inside the muscle. You need to remove the waste debris from the muscle damage. After the muscle damage, there will be a lot of small debris which need to remove from the local area and pushing away by the kidneys and eliminated in your urine. So what happened here, the better the immune response, you will get the better healing. Okay, that's why icing, prolonged icing, those things should be avoided after the exercise. Pain is not your concern, recovery is your concern. Don't treat the DOMS with the NSAIDs, which reduce the inflammation, which reduces the healing rate. Okay, this is very, 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 very vital. Being a physio, you even talk to the doctors, no problem, because this is the science. You should, if you know the science, absolutely no tension, no restriction for you to talk out. Okay, speak out about this. NSAIDs in the athletes going to harm their recovery process. And the another very important is the satellite cells. Okay, satellite cells, here the spelling mistake is there, I'm really sorry for that. Satellite cells, you can see in the picture the green area. Satellite cells usually the covering layer of the muscles. Okay, it covers the muscle, each muscle fiber. Actually this has the more amount of the daughter cells. Okay, when the muscle fiber break down, this produce the more amount of the daughter cells. This daughter cells binds the area to form the new muscle cells. Okay, the that's why like daughter cells will be equal to the amount of the muscle fiber. That's why you'll be having the hypertrophy, not the hyperplasia. Hyperplasia means increased number of muscle cells after the training. That doesn't happen in the human according to the science, but hypertrophy happens because of satellite cells give the daughter cells. These daughter cells grow the new muscle cells. Okay, so to get the very good growth stimulation, you need to make the muscle acidic. Why acidic? In the sense, when you do exercise, you'll get the burning sensation in your muscle near to the failure sets. For example, I'm lifting the 10 kg of dumbbell. 1, 2, 3, 4, 5, 6, pain started, 7. I'm pushing harder, more. That's why every time, every single time, when you train the athlete, when you train the patient, try to achieve the lactic acid secretion. This lactic acid is the growth stimulant. This lactic acid is what waste comes from the anaerobic energy system. Lactic acid is very, very essential, which makes the muscle acidic. That's why lactic acid, if someone having physios being taught in the university, lactic acid is the evil. You should do massage, you should do something to reduce the lactic. No, lactic acid should be there in the muscle, because acidic environment increases the growth hormone release. It increases the insulin like growth factor 1. Very, very important. This, do not forget. Every single time, if you want to get the hypertrophy or growth, you need to focus on the failure reps. Failure reps means the reps, the number which gives you the acidic feel in the muscle, that increases the acidic formation. This acidic formation improves the growth hormone release and insulin like growth factors, which very, very essential to cause nitric acid, amino acid binding to build up the very, very strong muscle fibers. The next one is the NO2, nitric oxide. This nitric oxide, whenever you do exercise, the muscle which you are doing get more amount of the blood circulation. Why? You need to supply the ATP. You need to supply the oxygen. So this happens through the dilating the vessels. So if you want to dilate the vessel, you need some chemical to dilate. That is the nitric oxide produced by the body. So when the nitric oxide after the exercise it increases, then the concentration of nitric oxide after each exercise will be increased locally and systemically. This improves the circulation of the testosterone and other hormones. Testosterone is what kink hormone, which actually enhance the muscle fiber strength by increasing the amino acids, protein synthesis, so on. And another one is the consistency. You need to stick with the consistent training. You need to train over and over in order to get the ongoing growth. Next. Okay, why fast twitch muscle fibers are important? Okay, lean muscle mass, it reduces the fat percentage automatically if you target the fast twitch muscle fiber by doing the strength training exercises. It improves the strength and power. Yes, your grandma can get up quicker, and she might be having the very good balance because her muscles are quite stronger, and she can run if it is possible. And it increases the collagen deposition in their tendon, because this strength training is the stress for the tendon to get the very good viscoelastic property. She will not suffer from the tendinitis. and more amino acid storage. Yes, BCAA, branched chain amino acids are quite higher. This helps for the many number of function. They are the energy storage. They can break and form the energy whenever you do not have adequate food. And prevention of muscle wasting, of course, if someone suffering from the HIV, cancer, any chronic condition, the muscle mass prevent their from deterioration will not happen that quicker as compared with the people with less muscle mass. And withstand the stress and injuries. Yes, if you fall with the very good muscle mass, you may not ending up with the lot of injuries, but lean people without muscle mass, they get the lot of injuries. And also the stress, ongoing stress. Why you are giving the strength training to the ONE? If they do have the very good muscle mass, it absorbs the stress. The ground reaction force will be absorbed by the muscle. It support the joint health. If you do not have the very good strength, definitely you'll be putting a lot of load on the leg, and of course the fat storage will put the extra load, which pushes the ground reaction force and degeneration. And musculoskeletal health, I already talked enough on it. And stronger neural control. Yes, strength training enhance the very good neural control, as it increases the very good the size of motor muscle fiber, motor unit will be higher. This may be a productive factor for neurodegenerative disorders in the later in the life. Okay, do the strength training, not only just walking. There are plenty of studies says people even with the walking, regular walking, if you go any doctor, they simply say walk 30 minutes. You'll be away from the insulin, you will be away from the diabetic, you will be away from the cardiac problems. No, that is not true. That is not true. That's what I'm saying. People who regularly walk 40 minutes, they have more sarcopenia than the people who don't do any exercise. Walking is the slow manner, prolonged way. It is the catabolism. I already told you, your branched chain amino acid will break down to form the fuel. It is the catabolism. So it increases the sarcopenia. What you need to focus is 2 days in a week walk, fast walker, and 3 days in a week do resisted exercise in order to prevent the sarcopenia. That's a very, very good call, which physio can do research and helping the others. Say strongly. Another one very important thing I want to say, walking and aerobic exercise increases the cardiac dilatation. If you see the cardiac muscles, the diastolic movement of the heart will be enhanced by the aerobic exercise. Concentric pattern, contraction power is enhanced by the strength training. So if you want to have the very good health, you need to couple both. I would suggest go more of resisted exercise or mixer the aerobic exercise at least 30%. That is sufficient to do. This is why we need to focus more on the resisted exercise for the older individual or any one who need to be safe from their chronic conditions. And another one beautiful example I can give, someone with the hypertension, what will happen every time when you do resisted exercise, you are increasing the nitric oxide production, and muscle contraction causes more relaxation of blood vessels. That enhances the vasodilation, which reduces the peripheral resistance and reduces the hypertension. Okay, so next slide. How we do it? Okay, what we're gonna do now, how to improve the muscle mass in a different area, how to target the fast twitch muscle fiber, focusing on the speed of the moves. Whenever you do exercise, when the movement is faster or movement is stronger with the more load, it recruit the more amount of fast twitch muscle fiber. So do not do the lot of hold isometrically, hold for 5 seconds. That's really the worst thing physio can do, is holding. Holding is okay. In very, very acute rehabilitation, holding helps. And I don't know why we are doing the isometric exercise such a long time. You just send your patient to the physios, they just do isometric. What after that? Isometric just okay in acute rehab, it's okay, but research is not supporting isometric alone is not going to help. It may reduces the pain, it may delay the the muscle wasting. But that is not only your goal. You need to gain the muscle mass. You need to gain the muscle strength. You need a progressive resisted exercises. Open kinetic exercise never gonna harm the ONE people. Okay, so be brave and be with the science to help these individual and speed up the movement. As I told you, you need to be more quicker in the movement, and you need to load the movement to get the fast muscle twitch fiber recruitment, and progressing the training early. So fast twitch muscle fibers are very sensitive. When the patient on the bedridden, they are the first one to go for wasting. So how early you are recruiting their muscle fiber with the exercise, that keeps them alive, and it improves the rehabilitation outcome. Regular strength training, eccentric control, focus on the eccentric control in order to have the very good hypertrophy. And next one is the blood flow restriction training. So one of the way good concept physio got is the blood flow restriction training. All over the world, people are doing fantastic job with blood flow restriction training. Unfortunately, in India, it's now is growing. My aim is, I wanted to teach this concept through webinar, through offline mode to all the physios. I'm using it regularly, and I'm going to teach you the few area of that. It's a complete course. You may ask me later to join that course, and we shall plan. We with the Chandramohan sir, we are also planning in future. So keep your contact with us so to serve better. So now I'm going to give you the some introduction on the blood flow restriction training, which will give you some idea, so that you can be interested in for the future course and learning yourself and practicing. Next slide, sir. So this is the model of blood flow restriction training. This is the picture you can see, A picture and B picture. Okay, so I could say this is the ACL injury, the guy with the ACL injury A, the guy with the ACL injury B. Okay, this A guy trained by blood flow restriction training concept. So he started yearly rehab by the blood flow restriction training, and he started walking with the this cuff they putting on the leg. That is the blood flow restriction during the exercise. He started walking and he started doing the exercise. So this three phase is the fundamental in the many areas. Many rehabilitation follow this three phase. One is the bedside rehab, another one is the active assisted rehab, and another one is the completely active with the resisted exercise, resisted mode. You can see the phase 1, phase 2, phase 3 in the picture, P1, P2, P3. Phase 1, what actually you're going to do in the bed is maintaining the muscle mass. Usually what happened? Wastage of the muscle mass because you are in the bed. Okay, our ideal goal is reduces the muscle atrophy. By BFRT, it shows that very good maintenance of the muscle mass even in the after surgery in the bedside. Okay, so and phase 2, phase 3, you are again doing the resisted exercises and you are keep increasing your hypertrophy. So the phase 3 will be very quicker in this athlete. But if you see in the normal progression without BFRT, he will be losing the whatever you do, active movement or doing the some passive exercises. He developed muscle atrophy. Muscle atrophy is no joke. It's one of the worst thing can develop in the athletes, which is most of the time difficult to reverse. At least 5 to 10% they still carry the muscle mass loss even after every surgeries. And during the walking, see, first phase you are reducing the muscle mass. Second phase you are maintaining the muscle mass when you do the active assisted walking techniques, and the third phase you are increasing the resisted exercises. So what happened then without BFRT? This significantly proven that it delays the rehabilitation outcome. This athlete need to go for quite longer period of rehabilitation. They will be losing a lot of muscle. They again need to focus on the training. This is quite big hectic work for us. So using the BFRT really quick up. Can you see the phase 1? You are maintaining. You are not allowing to go for atrophy. Phase 2, you are start increasing the muscle mass. The phase 3, you'll be having the very good of hypertrophy, and return to the sport will be higher. So we'll see how we achieve it. Little introduction of the particular technique. Next. So this is a PTS system, personal training device, which is a more commercial form of blood flow restriction training. But if you do not have money, it doesn't matter. You can just use the simple strap to do it. Okay, so this guy, he is doing the squatting. Maybe his left leg is having the kind of ACL injury or something. So next picture, I want to show this is how it looks. We'll see what actually it is. A BFR is scientific methods of training or treating. Okay, when you do exercise, you're actually increasing the blood flow to the muscle, but in the BFR, what you are doing is you are reducing the blood flow. Okay, so you are using the strap or pneumatic cuff to reduce the blood flow when the person doing the exercise. So what happened here? You conventionally you need 80% of one arm in order to get the hypertrophy, but with the BFRT you need just 20 to 40%. With the regular exercise, if you do 20 to 40% of exercise, you will be developing only the endurance, not the muscle mass. But with the BFRT, we surprisingly increasing the hypertrophy, even using the 20 to 40% of one arm. That's what the beautiful thing which you can do on the patient. So which means what? Elder people, they can do without using the higher weights. People with the pain in the musculoskeletal injuries, people with the post-operative, they can use this as the better tool, because they no need to use the higher load to harm their knee. During the recovery, you are using just 20, 1 kg or 2 kg weight cuff, still giving you the resistance, effect of hypertrophy which comes with the 15 kg. That's a very fantastic thing. What happened? You are going to reduce the blood flow, especially the venous blood flow, more than the 90%, and atrial blood flow to the 40%, up to 40%. So what happened here? 40 to 60% atrial flow is reduced, so ATP cannot reach inside the muscle. So muscle need to be trained with for the fatigue. Yearly fatigue you will be getting without better blood circulation. Also, the venous flow cannot go outside from the muscle because of your tying the cuff. So more venous pressure causes more lactate formation and lactic accumulation inside the muscle. I already told you lactic accumulation is very important to stimulate the growth hormone. So more the lactic acid you're producing by the blood flow restriction, because knee ATP cannot reach, body cannot utilize the oxygen to form the energy. So lactate is the byproduct. Without binding with the oxygen, it cannot eliminate from the system. So more accumulation in the lactic acid will be in there inside the muscle. This promote growth hormone stimulation and the insulin growth factor, which we already discussed. So surprisingly, also the blood flow restriction training, white fiber very sensitive to the blood flow. I already told you. So white fiber will be recruited more, and breakage of the white fiber will be more in the blood flow restriction training. That's why, what happened? More the damage is done to the white fiber, then what will happen? White fiber growth will be higher than the red fiber with the blood flow restriction training. So another one additional impact is endothelial growth factors. You're restricting the blood flow, body thinks blood flow insufficiency is going on, so body produce more amount of the endothelial growth factor, which enhance the growth of the vessels. So once you train again and again, it enhances the new blood vessel formation or blood flow. The lumen and the circumference of the vein or artery will be higher. So this is one of the protective factor for the better recovery in the any ligament injury. And the another one benefit is the osteoclast. When you put the blood flow restriction, venous pooling happens. This venous pooling put a pressure over the muscle put a pressure over the bone. This act as the one of the stimulus to improve the bone mass. That's why it prevents the osteoporosis also. So these are the few facts about the blood flow restriction training. The next. So this is the model, blood flow restriction training. You'll be creating the metabolic stress because you are restricting the blood flow, which increases the hydrogen ion and lactate, and which increases the hypoxia, which releases the more amount of the inflammatory responses, and it increases the your skeletal muscle remodeling. Okay, this is one of the fantastic concept which every physios should learn and practice effectively. The next slide. So indication where you can use the BFRT. In elder people, you cannot use the higher weight resisted exercises. So for them, it is safe to use to prevent the sarcopenia and other age-related issues. Even with the post injuries, I already discussed post ACL injury or rehabilitation of other post surgery. You can use this to improve the musculoskeletal health. I already told you white fibers are very important. To this gives you more amount of the white fiber gain. So musculoskeletal health also you can use. Sports specific training, of course, you can use to increase the lean muscle mass. Yearly diabetes and hypertension, how it will help. Yearly diabetics, usually because there won't be any vascular deficiency here in yearly diabetics. When you use this act as the protective for you. You will be gaining the more amount of the white fibers. In diabetic, muscle wasting also one of the major problem, and people will gain more weight with the diabetic. So using this to keep your muscle mass is one of the very important thing. And apart from that, I already told you endothelial growth factor will be higher with the BFRT, which means the neuropathic pain will be prevented by using the BFRT in later in the life. In neuropathic pain, what will happen? Blood circulation to the nerve will be reduced, but this increases the nitric acid secretion and endothelial growth factor, promotes the blood circulation inside the muscle and other parts of the body. Definitely, it's worthy to have. And putting the blood flow restriction also helps the people, yearly hypertension people, to control their hypertension. Is one of the best. And we do have the level 1 evidence for the blood flow restriction training in musculoskeletal health, and some research already going on with the yearly diabetics and hypertension. And I would say this has one of the good scope even in the erectile dysfunction, where we do have the problem in nitric oxide and blood flow to the penis. And for that, you need to use the bilateral leg exercises to promote the testosterone support also. And osteoporosis, you shall use this. Okay, next. Contraindication, of course, we do have contraindication and precaution. Acute MI, you should not use. And active inflammation or DOMS, during the delayed onset of muscle soreness or active inflammation, where the painful condition is there, you cannot keep increasing the venous pressure inside the muscle, because already the muscles are having the pain and inflammation. You should not use. Vascular deficiency, definitely I will not suggest you to use, because already blood flow to the muscles and the particular area is very less, which causes additional problem. And some areas like acute injury where the still bleeding is inside the musculoskeletal system, you should not use. In a DVT, of course, it's an absolute contraindication. Already venous stasis and formation of clot is there, and putting additional blood flow restriction give them very bad results. So these are the area which you need to be very, very cautious, and contraindication should be followed really well. Next slide. The final words, we are coming into the end of the theoretical session. Muscles are what make us move, okay? And muscles are important for the musculoskeletal health, not only musculoskeletal health, overall well-being. Train the muscle in the scientific way is what physio need to be focused. And I really bad and sad to see emerging of passive therapies and manipulations, chiropractic techniques in physiotherapy, which is definitely not superior to your muscle training. You may have the problem inside the joint. It's very simple. Muscles are moving the joint. When you train the muscle, automatically the most of the joint dysfunction get fine. That's the beautiful science. But you need to be persistent, and you need to be slow and steady. But we think, overthink, and we try to manipulate. We do that. This is okay. Any passive therapy, I still uses. I use all the passive therapy in order to make my patient fit for exercise. Okay, I need to pamper them. I need to give them some psychological support. I need to just push them to the active therapy. For that, I'm using the passive modalities and passive manual therapy. But If you stick only with the passive therapy, definitely you're just licking the cream of milk. You're not getting that complete or beautiful science. Movements are medicine. A PT can prescribe these medicine safely in order to treat and prevent many diseases and injuries. I really want all the physios to take the exercise as their core area of practice. Is already many fitness trainers and started treating the patients with the physiotherapy exercise prescription, which is really bad for our profession. Then we will be like working more of a technician, like putting the tape and doing the ultrasound, and some of the physios even taking this rehabilitation course to the non-physios. This is also should be stopped. Together we are the one who gonna make awareness. We're gonna save this exercise with us. BSc in exercise and physiotherapy also they started. That's why I'm saying, please, I cannot breathe without exercise. You all the physios join together to protect exercise therapy to go away from our hands. I don't know, like our seniors have done so much work. It should not go in vain. So together we'll be stronger, I believe, and we shall move to the why we shouldn't ask. Okay, someone asking cryotherapy. Okay, cryotherapy. What is the? We will discuss later. Okay, I'll be going for now. The question session. After the question session, I shall address the BFRT small session with the exercise I can show. And please, sir, please give me next slide. Stay connected. Together we are stronger. And I want to go for the question session, doctor.
Yes, Rupesh, are you there?
Yes, sir. Yes, sir. I'm here, sir.
Let me see my face, so I get more confident.
You can stop screen sharing.
Okay, Bhairav? I should stop screen share. Yes.
Yeah. Yes.
So I hope you guys enjoyed a small session from me, and I'm open for the questions. With the moderator, I shall answer the questions.
Yes, sir. Thank you, sir. About cryotherapy, you told you will be speaking later, no, sir?
No. Now I can talk. Okay, cryotherapy. Yeah, yes, very very fundamental. One question always ask yourself: any injury that start with the inflammation as the recovery. Okay, these inflammations are very very vital to remove the debris, to promote the blood vessels. To promote the blood circulation. Blood circulation increases amino acid transmission, collagen deposition, to promote the healing. Another one thing is new blood vessels are supposed to be formed. To form the new blood vessels, we call them I forgot that medical terminology. I'm sorry. Nervosa, vasonervosa, and this to form you need mechanical pressure. Okay, angiogenesis. Yes, mechanical pressure. This mechanical pressure formed by the inflammation. Okay, acute inflammation is not the bad sign. We are more scientifically, if you want to treat the pain or if you want to increase the healing, that is the biggest question mark here. If you treat the athletes, please, they are the one, they can handle the pain, of course. Okay, you don't, after the any acute hyperacute injuries, today I fall, now I fall, then I can use the ice to stop bleeding. Wherever you fall, there will be the internal bleeding, which you should stop by the putting the ice compression and elevation. That definitely arrests the blood. More amount of the blood accumulate inside the muscle also is not a good sign. It can cause us more amount of the debris formation. But after one day, you should not use the ice for the athletes. Why? Because you allow the healthy inflammation to start. And this healthy inflammation causes pain, of course, but it has the very good amount of, it sends the more amount of the inflammatory mediators to remove the debris. It forms the new blood vessels. Also, it allows the yearly rehabilitation. So, if you are having an athlete, you can start training earlier to prevent the other unwanted stuff. Okay, and stop using the NSAIDs, non-steroidal anti-inflammatory drugs. This carries, any athlete who got injury, if you treat with this aggressive mode of the medication and other therapies to reduce the inflammation, then inadequate inflammation takes this individual to create the chronic injuries, chronic sustained injuries, okay, which don't recover easily. That's why, extracorporeal therapy, why you are doing extracorporeal therapy in the plantar fasciitis. There is inflammation, but you need more inflammation to kickstart the recovery process. Got it? This is what, to prevent the chronic sustained injuries in the athlete, you need not to treat aggressively with the anti-inflammatory stuffs. Next, any question?
Fine. Question is, what can be the exercise prescription so that only fat is lost, keeping the muscle mass?
Okay, this is one of the fantastic questions. If I do only the strength training, there won't be much fat loss. That's the truth. Okay, I keep growing my muscle, but fat will be there. It don't add up more fat, but fat, whatever I was having, it will be there. For that, I need to do the cardiac exercise. If I do cardiac exercise, again I reduces my muscle mass with the fat loss. That is also not a good sign. So what we suggest is, what the science suggests is, do the HIIT, high intensity interval training, as the mode of fat burning exercise. Okay, what happened here, there is a zone called as fat burning zone. You will be using the high velocity movements to reduces the still you are making your strength fiber alive, because strength fiber is what doing the high velocity movements. Intermittent cardio exercises, this is the best for the reducing the fat alone, preserving the muscles, also with high protein diet.
Fine, sir. Fantastic answer. Next is from Nitya. BFRT time period to use.
BFRT you can use lifelong. The ideal protocol is weekly, twice maximum. Okay, that's why I said today, if you use BFRT, usually causes more DOMs than the without BFRT. Okay, even though BFRT uses the less resistance, still it causes more muscle breakage because of the hypoxia and lactic acid stimulation. So you can use as weekly, twice. And if you are using for the cardiac, even for aerobic activity also, you can do BFRT. For that, you can do for 20 minutes weekly, twice, any mild jogging or cycling, static cycling or something you can do. And BFRT, to be honest, I'm giving you here introduction only. BFRT is a beautiful concept. To take that only, I need 2.5 hours time. So we'll be having a collaboration with the Dr. Chandra Mogan, and we'll be taking that session soon. If you are really interested, it's one of the concepts I need to reach to all the participants, because this should not go away from our hands. Tomorrow fitness trainer will come and they learn BFRT and they become master in that. Finally, use cryotherapy. Someone asked questions. Next question, sir.
Yes, sir. So next is from Mr. Rajkumar. So why we should use ice therapy after exercise? When and what way we can use cryotherapy in exercise?
Cryotherapy in exercise, so many people, bodybuilding industry, they use the hypoxia by using the cryotherapy. As I told you, blood flow restriction. When you do cryotherapy, that also causes the metabolic demand. Okay, so they uses the cryotherapy in between the exercises to reduce the blood flow, but that is not that effective as BFRT. Okay, so after the injury, as I already told you, you need to be a judge here, clinical expert. If it is old female suffering from so much pain, definitely you need to give pain reduction. But if it is an athlete, definitely the small injuries and inflammation is not a big thing for him to worry about. So I would suggest you should be the good judge to decide where to use, how much to use.
Yes, sir. Fine. Next is from Ms. Kritika. So what to do for cancer patients to prevent from sarcopenia and how to train them?
For cancer patient, again, BFRT so far not so well researched. Why? Because cancer patient also may suffer from the other comorbidities. So they cannot recover from the exercise so quicker. Very important is they do have less energy. They do have a lot of muscle loss. Okay, and if you know, okay, if you treat the cancer patient, so far a lot of aerobic exercise are in acute cancer recoveries they are promoting. Why? Because very good oxygen delivery, and you need to keep the muscle with the very good energy. You know, I told you fatigue, they get muscle fatigue quicker. So target more in acute during the chemotherapy. Exercise prescription should be more with the mild to moderate aerobics. But later on, once they recover from all the acute episodes, definitely you can use as the weekly 3 to 4 days of strength training. We call them split training. One day you will be having the upper body focus, the next day will be lower body focus, using the 3 to 4 sets with very good nutrition supply support. Definitely you can do this, and it's a slow and steady track. Okay.
Yes, sir.
Can we use BFRT in the cardiac patient? Cardiac patients are so many cardiac patients are there. Acute MR, MI also cardiac patient. So BFRT is very effective in early cardiac patients. Okay, where there won't be any issue. Studies have been focusing more on the early cardiac patients, early hypertension, which is regulated by the. I mean, you are not having the much of fluctuations. Okay, BFRT is safe. It's not that much worry we need to put. It's one of the safest concept. But for the safe side, unstable cardiac patients, risk of developing the MI, we should rule out. That's the area we should be very cautious.
Fine. The next is from Ms. Risika. Sir, is there any alternative to reduce pain and promote angiogenesis without using cryotherapy or NSAIDs?
Angiogenesis, yes, angiogenesis, you know, new blood vessel formation and blood flow. Resisted training is what does. As I already told you, if you grow the muscles, definitely muscle grow the vessel inside. If you have better muscle mass, the vascular diameter also better. That's why if you see in the bodybuilders, they do have the dilated vessels. The dilated vessels, what the better blood circulation. You know, one thing keep in mind, any musculoskeletal injuries, if you train the muscle, you're not only training the muscle, actually you are increasing their all the metabolic, all the vascular and soft tissue health. Okay, you're not only the improving the muscle mass, you're actually working on one thing as a whole. Can we use okay, can we use BFRT in diabetic people? Yes, that's what I said. Diabetic without neuropathy. Okay, you should not have the significant neuropathy. You should not have the vascular deficiency. Then you can use that. In diabetic people, it is much helpful. Not all the diabetic people are same. Okay, so you can definitely use. Can we use muscle? What is that question, sir?
Can we use muscle type change with the training?
Yes, that's what I said. Today I am bodybuilder, for an example. I do have more amount of the white fiber. If I started training for the endurance activity in a 3 months, my white fiber change. I mean white fiber forced to change to become the endurance fiber. Okay, that's why your muscles are dynamic in nature. Okay, the load which you are forcing, they become definitely.
And I'll read questions because a couple of questions are above.
Yes, please. We shall go slow and we address all the questions.
Yeah. Next is from Mr. Rajkumar again. Sprain, can we use cryotherapy? Can we use up to 48 hours? Whether BFRT having evidence-based practice?
BFRT is evidence. It has the level 1 evidence. We have the meta-analysis, systemic reviews, and BFRT is almost last 20 years almost it is there in the training, and last 40 years in the bodybuilding industry, and recently we updated with the rehabilitation protocols. Definitely it has very good evidence, and it is a evidence-based practice. Personally, you know, I should not talk like personally, but personally I treated a number of patients with the BFRT. They shown me very good recovery. And surprisingly, after BFRT in OA patients, she is not having the much pain. I even wonder, some kind of mechanism should be there because of the nitric acid production and growth hormones. This all also the increases the when you do the BFRT, it causes the burning sensation. This burning sensation can releases the endorphins or something. Definitely, it works to improve the pain outcomes.
And next, Mr. John, for geriatric patients, which type of exercise will give balance and muscle tone, like exercises or any other suggestion?
Sorry, again question.
Geriatric
Rupesh,
patients,
your audio is breaking.
which type of exercise? Now, sir, now is it fine?
Yes, now it's okay.
Yeah. For geriatric patients, which type of exercise will give good balance and muscle tone, like endurance exercises or any other suggestions?
Okay. For geriatric population, you need to focus 50-50. Okay. For cardiac health, you need to work on the endurance exercise. For musculoskeletal health and other systemic health, you need to work on the resisted exercise. The better is 50-50, the coupling, I mean, your mixer up. Either you can mix up one day resisted exercise, one day cardiac exercise, or in a single day only, you can do resisted exercise first for 20 minutes, then 20 minutes for static cycling or some low to moderate grade aerobic exercise. Always mix both to have the better outcome.
Next question.
I think
Rupesh.
someone else can do because Rupesh is having a lot of breakage.
Okay. Where did he left? He may be having a lot of questions in his
Hello.
private chat box. Vairav, can you read out? Okay, wait, I will read it out. No problem.
Okay, sir.
Okay, can we use BFRT in diabetic patients? Did you answer that?
Yes, sir. We can use safely.
Can the muscle type change with the training?
Yes, answered already.
Okay. Okay. Which is the best exercise program mixing the anaerobic and aerobic same day, or can we do separate day for aerobic and anaerobic practice?
Always mix both in a single day or mix alternative days. Is about the percentage for the general well-being without sports demand. You shall use the mixture of aerobic and anaerobic in a single day or every alternative days to have the better outcomes.
Okay. So the next question is from Sahil Panchal. Nowadays, a new trend is in force in fitness industry of taking ice bath after workout. What are your views on that?
The ice bath after is one of the physical, stimuli. Okay, our body, is like you're putting the some extreme physical temperature modification to the body to releases the all the adrenaline and other hormonal release. And so far, I'm not having much idea on that, but I've seen many fitness enthusiastic people being used, and I could say this is to reduces the domes, one of the another thing, and to reduces the pain from the previous workout, but it doesn't have much on the other the outcomes which we actually desire for. They are believing it aids for their recovery, but it's more of psychogenic.
Okay, thank you. The next question is from Kritika. Can we change the type of muscle fiber through workouts?
Yes, we can, we should. Your grandma might be having the more amount of the red fibers. That's why she's suffering to get up from the bed. So when you use the resisted exercise protocol, she can get up very quicker. Okay, that's why I say train the white fibers in the geriatric population, which is really bad at them. So we shall change through the plan. I can make even we can make even Usain Bolt to become a marathon runner by training, but it takes time, 1 or 2 years or 3 years maybe with the training.
Okay. Is there any other questions? Participants, kindly write it. Or anybody wants to ask directly, just raise your hand. Another one more question from Shreya. Do you suggest cold or hot water application after workout?
You can, if you have more sweat, you can take a bath, definitely. Cold or hot water, that's what I'm saying. Like if you have the pain, for the recovery we call them, one of the very important factor is the cortisol. If you have the mental stress, if you have the physical stress, your body goes, it releases more amount of the cortisol. This cortisol is act as the catabolic. This, it inhibits the testosterone, it inhibits the anabolic reactions. So this is not a good thing. That's why after the training, more people more feel like drowsy, feel like sick. So for them, the recovery strategies like massage, using the cold waters or mild warmth, this can promote the more amount of the comfort, which psychologically reduces the stress, and definitely it helps them to reduce their cortisol. Also it promotes the sleep. Sleep is very, very essential. Definitely you can use this. Hot water or cold water depends upon the weather of your country. In now summer, we of course we love to take bath with cold water. If it is very cold, definitely hot water bath is very essential.
Okay, no more questions. More appreciations for you from a lot
Thank
of
you.
participants. And I personally thank John Titus Emmanuel and Kannan Murali. They are my friends.
Okay.
I just see them in the chat session.
Okay,
Okay,
sir.
thank you for coming by. And I thank all the participants.
We are having a small practical session.
Yeah, sure.
Yes.
How many are there? Yes, we have. Yeah. Okay, go ahead. Okay, thank you so much. I thank all the participants for having patience and waited till the end of the session. And I thank even participants from Malaysia. Just now they left actually. And I thank my team members, Dr. Rupesh and Tuna, for sitting longer time. And another co-host, Dr. Vairo also. And I thank all my friends who are there in online. And I thank you, GD, for your wonderful session. It was a lengthiest session, I think.
Thank you. Thank you so much, sir.
So much. I will meet you all tomorrow by 7 p.m. Bye-bye. Good night.
Thank you, sir.